Hey, this is Greg here from Big Bay Mornings on 99.7 Now. And of course, if you're on this website, you know that guy. It's Dr. Bae, board certified plastic surgeon. Hey there.
Hey, Greg. Thanks for joining me.
Absolutely. It's always great to be here, especially, from month to month when we do these, I compile a list of questions that my friends ask me. They sort of think because I know you, I know all the things that you know, which is not
You're
necessarily
right.
true.
Yeah, you're a plastic surgeon adjacent. You just skipped the whole
Exactly.
med school thing.
Exactly. I had a pride party a few weeks ago, and a question. One of my friends who just turned 50 was there, and she wanted to actually talk to you. She wants her breasts perkier, but she does
hmm
not want her breasts larger. And she didn't know, would she have to get some kind of implant to make them perk up, or is there a way to do a lift without, like, she really doesn't want to go bigger?
Right. So, absolutely, there's definitely a way to be perkier without going bigger. And so, instead of getting breast implants, you would get a breast lift. But it's not just straightforward like what type of breast lift. Everybody's a little bit different. And some people think that we just decide, okay, we're going to do this type of breast lift on you, just like how we feel that day. We're going to do that type or that type. But it really is how droopy the breasts are. And like if you've had kids and your breasts are pendulous, my favorite word, after breastfeeding, that can make them a little bit droopier. And so it really just all depends on how droopy they are and basically where the nipple is in comparison to that fold under the breast. It's called the inframammary fold. So basically, if the nipple is just below the inframammary fold, then maybe you just have a little bit of droop. And so that would be one type of breast lift. If it's further below the fold, then that's a different type of breast lift. We have to remove more skin to get them back up to where they need to be. And if they're like pointing down and really droopy, then that means we have to remove even more skin, which means we have to make even more incisions. So that brings me to the different types of breast lifts. One is the one that needs the least amount of lift is maybe you just need a little crescent of skin taken off the top of the areola, and that can help just reposition the nipple a little bit. So that's really just you want the nipple to be in a better position, but your breasts look fine otherwise. Now, if you have a little bit more droop, then you have to remove more skin. You can also take skin around the from around the areola and just basically take a donut of skin, and that's why we call it a donut lift. And that helps tighten up the breast skin and brings up the breast and the nipple at the same time. If you have a little bit more droop, then we'll do what's called a lollipop incision, where we make an incision around the areola and then up and down. And that's just to bring up more skin, take out more skin to give you more of a lift. And if it's as droopy as you're worried it is, then we would do an anchor lift where we make an incision around the areola, a vertical incision, and then an incision under the breast. And by removing all of that extra skin, we can bring the breast back up to where it is. And remember, we're not reducing anything. We're not taking out any breast tissue. We're just tightening up the skin envelope to give them that perkier breast that they're looking for without fat injections, without an implant if they choose.
So you're able to keep all of their breast tissue that they naturally have, and you're just able to bring it up into a position where it was when they were 22 rather than,
Right.
my friend, like she's 50. Okay, that makes sense to me, but I'm glad I
And
did not try to explain this to her at my pride party. It would have been it would have been very strange.
es- especially since there might have been alcohol involved at the pride party, so you might
Might
not have gotten
have.
all that clear.
No,
Might
there for
have,
sure
but
was.
but that's actually you bring up a good point. So if they are looking to get a breast reduction, it's actually the same types of incisions, and so the only additional thing you're doing is you're taking out breast tissue in addition to doing the lift. So a breast reduction includes a lift. A lift doesn't necessarily have to be a breast reduction. So very very key point. A lot of patients don't understand before they come in to see me.
Awesome. Well, tell my friend and everybody out there watching these videos how they can communicate with you the best and get in and see you.
They can easily just text us at the office. They can text our office number, 415-923-3005. They can call that number too. They can also direct message us through Instagram at Real Dr. Bae, RealDrBae, not BAY. And of course, they can always watch us on social media, Real Dr. Bae, Instagram, Snapchat, TikTok, and check pricing at realdrbae.com/pricing. We're very easy to get a hold of.
Awesome. Thanks so much, Dr. Bay.
Thank you, Greg.